Here we go. Dr. Pakman, hi.
How are you, Mr. Flash?
Very good. Dr. Pakman, today, why don't we talk about, this time, why don't we talk about dentures versus maybe implants or, you know, I guess dentures and implants, those are, I think, the only two options you have once it gets to that stage.
Right. Well, when we talk about dentures, and I'll assume that we're going to talk about full dentures when someone is missing all of their teeth. We still do a lot of full upper and lower dentures. It's still a viable thing for people because they're not going to walk around without teeth, so they do have to have something for appearance and for chewing. The problem comes when people have had their teeth removed at an early age, and as the aging process goes on, we lose the bone, the ridge that actually holds the denture in. So now we've got dentures that move and slip and are uncomfortable, and it's hard to eat with. That's when implants come in, because if we place several implants and then attach the denture to the implants, they don't move. So we now have, for denture patients who never really had a solution, they had to put all that gook inside the denture adhesives to try to hold them in. Now we have a viable alternative for them. We can place several implants, attach the denture to the implants, problem solved.
Okay. So that's still a denture with only a few implants, right?
Yes.
Does that prevent the arch, the bones, to shrink or not?
Well, in the area where the implants are placed, the bone will last longer than in areas where there is no tooth or implant. But the denture itself that attaches to the implants doesn't put the same pressure on the gum and the bone that a traditional denture does, so the bone will last longer.
Okay. But so overall, however, so when you put an implant in it, that kind of gives it the same feeling than the actual tooth is in it, and your bones are not shrinking.
Yes, correct.
And so let me ask you, those people, you know, especially like the, you know, grandmas, but many other people, when they start having this caved-in face, like a dried-out tomato, basically start looking ugly.
Yes.
That has to do with you lost your teeth, you didn't replace them, or you replaced them with dentures only. Is that true?
Well, not necessarily. When you see people with that sunken-in look, that usually means that they're missing their posterior or back teeth. A denture, however, a denture properly made will fill that in, so they won't look sunken in that way. So dentures can make you actually look a little younger. In fact, if you've ever seen a person of whatever age, if they take the denture out, they look about 20 years older.
Right. Absolutely. Now, nevertheless, dentures and implant, will the implant shrink your bones less than having dentures?
Yes.
So
yes.
Over time, even though the denture fills you up a little bit, the implant would make you even look still better or keep you longer looking better, yes or no?
Correct. That's correct.
Well, that looks like a good deal to me. Simply, you know, even though it might cost a little more money, but it avoids plastic surgery, and most of us at that point probably won't do it anymore. But it's just, you know, there's something about looking good.
Absolutely.
And absolutely wonderful. Good. Now, and again, if there is a money situation and a person does take some dentures for a while, a year, 2 or 3, till he saves up for the implant, would that still be an acceptable thing to do rather than going 25 years with a denture?
Yes, it would be. You could wear the denture for several years and then transition to a denture with implants.
So doing that, he can still avoid the shrinking of the bones and
yes, you can.
And they're looking like a cabbage, something, whatever.
Right.
All right. Good. Well, thanks a lot, Dr. Pakman.
You're welcome.